I'm married to my wife Rebecca, and we have 3 children. It's a busy life. We keep on the go. Luke has done karate. Luke actually earned his junior black belt in karate a couple of years ago. Jackie does gymnastics, and she also just started in cross country this year. And Joy just causes trouble. But it's fun. Well, this year we bought passes to Stone Mountain. So we've gone a number of weekends to Stone Mountain. We've hiked up the mountain several times, and that's fun. And then we've done some of the other little activities. I think just a few weeks ago we went and played mini golf and rode the train around Stone Mountain. So we love, I love family activities. We love going to the beach. We take a beach vacation pretty much every year together, and just like to play in the water and play soccer on the beach with the kids. I've had the chance to go on a number of mission trips, starting back when I was in medical school. I actually went to West Africa and did a mission trip then, worked with a missionary there. But from there I've had the chance to go to Haiti and do medical work, and to Peru and do some medical work. And then the latest was I went to Kenya, and we worked in a slum of Nairobi, Kenya, and did a medical clinic there. And this was the first time my wife got to go with me on a mission trip. She's a nurse, so she was able to go and work with us as well. There was one time on that first trip when they were doing surgery, and it was very different than surgery in the United States. They didn't have general anesthesia. I think they used a spinal anesthesia like you'd have for when you're having a baby or having a C-section. And this was, I think the lady was getting her appendix out. And the monitor, the only monitor was me checking her blood pressure and her pulse about every 5 minutes. So that was my job. I was the cardiac monitor for the surgery. So it was kind of, everything was totally different. The hospitals had animals running around, chickens and pigs running around in them. Very different. And each time has been different. Haiti is a different experience. Obviously, it's a very lower economic situation country where they don't have a lot of resources. Peru, we were in the jungle, kind of the Amazon jungle there in Peru, and so that was also a very different environment to be in. But in all of them, it was, it's similar. You see a range of things from not all that sick to very sick, and obviously you have the medicines that you brought with you to treat people. So you do what you can. You see a lot of parasite infections and wounds and that sort of thing in this situation. We worked with a pastor that we know through our church, and we worked in his church. His church is there in the slum, and they're kind of ministering to the people there in that slum. So they wanted us to come and just help and provide this service to show the people kindness and love and help with the medical issues. We stayed on some property that the church that we were working with owns. They actually have a girls' home where they rescue girls. They've kind of been sold into slavery. They rescue them and keep them there. But we stayed on that property. And so we'd get up in the morning there, we'd have breakfast, and then we'd get in the car and drive what here would be about a 30-minute drive, and it would take us about an hour and a half because the roads are terrible. There's no way to really count, but estimates are there's over 1 million people living in this slum. The pastor would get the word out before we came that we were going to be there, and so people would just start lining up outside the church, and they would bring them through, and we would check their blood pressure and have them come in and talk to them about what's going on with them and try to treat them, and with medicines, and then just show them compassion and care and that sort of thing. We'd be in the church most of the day and just be there working. We'd work from about, I think we started at about 9. We'd have to leave before too late because, as I said, once it starts to get dark, it gets really dangerous in the slum. So the pastor there wouldn't let us stay any later and would bring us out about mid-afternoon, so for our safety, really. We would see, I think I lost count, but we would see over 100 patients a day. Me and one other doctor would work there and saw some from sinuses and runny noses to, people that were really, really sick. We ended up having to give one kid who had sickle cell anemia, had to get IV fluids and oxygen there, and people with wounds and infections, and just kind of some things we don't ever see here, we got to see there. You do have a chance to sit down and really talk to people and hear their story and learn about their life. Sometimes you do realize, these people have gone through amazing things, or incredibly difficult things, or just the way the things that they've experienced in their life are amazing. And so sometimes really just to get somebody's story and to connect with another person's life really does kind of help you to open more, to remember why you're doing this, that you're here for people, here to help people and help them to be healthy and to be able to enjoy their life.